Dhaka has faced several number of earthquakes in the last few days. And apart from the physical hazards, earthquake has also affected the people mentally. Earthquake has significant mental health effect. And today I'm going to discuss about the effect of earthquake on mental health. Within 72 hours of an earthquake, do you feel sudden fear, sudden panic of another earthquake? Do you have rapid heartbeat or abnormal shaking of the hands or body? Or do you feel confused? This is called acute stress reaction to an earthquake. But after 72 hours, up to 4 weeks, if you are still scared of small vibrations, small movements around you, which makes you think about the possibility of another earthquake, along with if you have difficulty in sleeping, and you are still constantly checking the social media for the news of earthquake, that is called seismophobia or earthquake anxiety. But in these 4 weeks or first 1 month, if you're constantly thinking about the aftershocks, which are the consequences of the main earthquake, and because of that, if you're having rapid heartbeat, shortness of breath, and if you're scared of entering into a building, that is called aftershock anxiety. But after 1 month, if someone still thinks about the episode of earthquake, if there is still persistent sadness, hopelessness, and difficulty in sleeping, and loss of interest in regular work, fatigue, this may mean the person is having the depressive disorder or depression. After 1 month, some people may have the flashbacks of that past earthquake episode, along with some nightmares which wake them up from sleep. And they may also avoid the buildings or places with the memories of that earthquake. These indicate post-traumatic stress disorder.
Now, how to manage the mental health issues after an earthquake? For acute stress reaction, grounding technique and box breathing. For grounding technique, we can use 5-4-3-2-1 technique. For this technique, you need to sit comfortably, take a deep breath in and out. Then identify 5 things you can see, 4 things you can touch, 3 things you can hear, 2 things you can smell, and 1 thing you can taste. This will reduce your anxiety, calm your nerves, and keep you in the present moment. For the box breathing technique, you will sit comfortably and breathe in for 4 seconds. Hold the breath for 4 seconds. Breathe out for 4 seconds. And again hold the breath for 4 seconds. In case of seismophobia, some people may have phantom quakes. That is a feeling of an earthquake when there is no earthquake at all. If you feel phantom quakes, you need to do cognitive reframing. For that, you need to place a glass of water on a table. When you feel shaking, look at the water. If the water is stable, say to yourself that the ground is stable. I am resetting my internal balance. This visual confirmation overdrives the vestibular confusion. In case of seismophobia, you also need to restore your normal routine. That means you need to restart your normal work life. You need to maintain your regular sleep schedule. And you should talk to your close people at home and at work when you are feeling low. You should also prepare an emergency kit
for an earthquake. It will give you reassurance and relaxation from anxiety. Some people may develop depression and PTSD. They should consult a specialist, mainly psychiatrist and a psychologist. In case of PTSD or post-traumatic stress disorder, patient may need exposure therapy, cognitive behavioral therapy, and eye movement desensitization and reprocessing. At the end, remember the effects of earthquake on mental health are real, because earthquake may last for seconds, but the effect of the earthquake, the aftershocks of the mind, may last much longer than that. So, take care of your mental health and spread awareness.